Welcome to Diabetic. This channel discusses emerging technologies, new medicines, and products and services designed to improve the quality of life for diabetics, young and old. Regardless of whether you've just been diagnosed years ago, or perhaps caring for a dependent diabetic, there's something here for everyone. So please stay tuned for the next edition of Diabetic, coming your way in just a moment. Welcome back. Today we're discussing the need for every diabetic to build a health team. You may ask, why do I need a health team and what does a health team look like? Well, when you were diagnosed, you were more than likely diagnosed either by a family physician or a primary care physician. And those doctors are general doctors. They know what to look for various issues. But they also likely referred you to either an endocrinologist or an internist. And those doctors specialize in diabetes and will know exactly what to look for further complications or any issues that might come down along the line. However, there are specialties beyond that diabetics will need over the course of the progression of their disease. For example, one of the first symptoms of diabetes likely affects your eyes, and you notice your vision was distorting. Well, every diabetic needs to have a good eye doctor, but there's a lot of confusion as to what type of eye doctor you need. You've heard of optometrists, you've heard of opticians, and you've heard of ophthalmologists. Well, let's go ahead and just briefly describe the difference between them. An optician is a certified professional trained to fit patients with frames, frames with lenses, and lenses with the characteristics that are prescribed by the doctor. For example, you may need bifocals or trifocals. The patient also has options such as having anti-scratch features or perhaps features which will darken the lenses as you go out into a bright sun. So think of an optician as a pharmacist for corrective eyewear. Now, an optometrist is an eye doctor that examines patients to determine whether corrective lenses are necessary. In addition, they will also screen for eye diseases such as retinopathy, which is a common complication in diabetics. Should your optometrist have any concerns about the health of your eye, they will likely refer you to an ophthalmologist. The ophthalmologist is an eye doctor who specializes in diseases of the eye and are also qualified to do eye surgery. I would suggest discussing with your diabetic doctor the wisdom of visiting with an ophthalmologist and getting a baseline exam even while your eyes are healthy, regardless of when you were diagnosed. The idea behind this is that an ophthalmologist or an optometrist can follow your eyes as your disease progresses and determine whether or not diabetic retinopathy is becoming a concern for you at any given point. So we've covered the need for an eye doctor, and we've discussed the different types of eye doctors there are. Now let's talk about a diabetic educator and a diabetic nutritionalist. Now these are individuals that are going to help you understand your disease and know what to look for. There's a lot of different issues that diabetics experience. Hopefully you don't experience all of them, but the whole idea is to understand them before you get them so you know what you're looking for and you can address any issues as they come before they become more serious. Now, nutritionalists are going to help you understand how different foods affect your blood sugars. There's what's called a glycemic value. Each food has a glycemic value which indicates how fast it's going to raise your blood sugar and how much of an impact it's going to have while trying to maintain your blood sugars in a steady and predictable way. So it's important to understand how many carbohydrates you should be eating in a particular meal. Eat too many, your blood sugar is going to spike. Eat too few, you may wind up having a hyperglycemic event or your blood sugar dropping too low. So again, even if you've just been diagnosed, this is the time to do that, to understand how different foods are going to affect your blood sugars. The lower you can keep your blood sugars and your HbA1c levels, the healthier you're going to live and the more you're going to be able to do with your life. Now you say, okay, what's an HbA1c? HbA1c is just simply a 90-day profile or average of your blood sugars. So if you're able to keep that HbA1c below 7.0, you're doing a great job managing your diabetes. Now, those of us who have been diabetics for a long time may be becoming more brittle, in which case it's harder to keep that HbA1c at a lower level. However, it's not impossible. This is why the diabetic educator helps us to understand what we can do to more effectively keep our blood sugars within an acceptable level. So again, if you have any questions or if you can add some light to this discussion, feel free to leave these comments in the comments section below. I'd love to hear how educators and nutritionalists have helped you, and these comments also help diabetics who have just been diagnosed understand what they're dealing with and understand better how to maintain their diabetes. A lesser known complication of diabetes is gum disease. So as a part of your health team, you need to include a dentist who is familiar with working with diabetics. High blood sugars encourage infections in the gum, which can also go into the bone that holds your teeth. So it's absolutely important to tell your dentist that you are diabetic and to give them an idea as to how your blood sugars have been recently. They'll be able to determine if special treatment is necessary to ensure the proper maintenance of your teeth. Now, I understand that any infection of the gum can actually back travel to the heart and cause even more significant issues. You need to discuss this with your doctor and get the facts so that you can mitigate any risks of gum disease and potential heart issues. The ugly truth behind diabetes is that it is one of the leading causes for heart disease. Among all my medical team members, my cardiologist is one of the most important ones. Simply put, if the heart isn't ticking, the rest don't matter. Depending on how long you've been a diabetic, there are a number of other complications which again can be illustrated in a worst case scenario. Please understand, I'm not here to try and scare you. What I'm trying to do is to encourage you to get ahead of the potential complications by giving yourself the best chances for a full life by keeping your blood sugar low and working with your medical team to ensure that you're doing everything you can to lower the risks of any complications. If you've just been diagnosed, you're in a great position to do things the best way you can possibly do to give yourself every advantage to keep diabetes under control. So thank you again for watching this video, and let me encourage you to do everything you can to live your best life in spite of diabetes every day.